Welcome, everybody, to this discussion today about mobility and stability. My name is Michelle Desser, and I'm the Director of Education at Functional Movement Systems. And I'm so excited to be here with you today and you taking time out of your day to be here with us to talk with Lee Burton and Gray Cook about this foundational concept of mobility and stability, really what all of our screening is based upon, right? We have this systematic approach to screening and assessing and testing both mobility and stability. Now, we always lump those together because there is a symbiotic relationship between them. If we were all just mobile, well, we'd be like those things in the car parking lots without any stability. If we were all just stable, we'd be like toy soldiers and we really wouldn't have adequate movement. This symbiotic relationship between mobility and stability is so important for us to get through life doing the things that we'd like to do. Now, without further ado, I do want to remind you, we're here to answer your questions. So please go ahead and drop any questions that you might have as this production goes forward, and we will be happy to send those to both Lee and Gray and answer those within the chat. So without further ado, I'd like to send it over to Lee Burton and Gray Cook to kick us off into this mobility stability discussion.
Thank you, Michelle, and really appreciate you guys, as Michelle said, taking time out of your day to join us. And as Michelle also said, please send those questions over so we can get those. We're going to wait and hold the questions where we're going to answer some stuff live at the end of this session. So but go ahead and drop those in. And let's just dive right in, Gray. I mean, mobility and stability is extremely popular as professionals. And I think for us, with being some of the pioneers in movement screening, movement assessments, ultimately we're trying to get you to move better. And our mantra is move well so that you can move often. And to get you moving well, we need to make sure you have the fundamentals or foundation set, which is making sure you've got good mobility and good stability. And it is a combination of both that allows that movement to occur. And really part of what we're going to try to get into today is figure out, where do I need to focus? How do I need to put this, where do I need to put my expertise on exercise recommendations so that I'm not just throwing out a bunch of exercises at somebody? And that's what screening assessment does. It allows us to zero in and say, this is probably the best option right now for this person as it relates to exercise, Gray. And then what I then need to follow up and do, which a lot of people don't, get the feedback to make sure that whatever exercise or whatever approach I take works. And that's why it's so important to set the baseline with the screening and assessments, and then go back and recheck and get that feedback so you can ensure that whatever you prescribed works. But ultimately, we're trying to zero down, and that's what we get to in some of these fundamentals, Gray, talking about mobility and stability.
You hit a key word, you said recheck. And you can't recheck anything you didn't check the first time. So when you go to the internet and you see discussions specifically involving exercise or self-care about mobility or say stability problems, because when we say stability, everybody's just using the word core to cover that. So I need to fix my core or I need to fix my mobility, and Google answers that question every day, and so do a lot of professionals. And I think they're both wrong, because I got to ask you a few questions. And if I ask you questions, Lee, you feel stiff? Yeah, I feel really stiff in the morning and after I've been standing in one place for 30 minutes. Good. That's a survey. Now, I'm going to screen you and see if your facts and your feelings line up. And very many times they don't. Or you're actually stiff on one side, but you have low back pain on both sides. So there's a lot to unpack here. And so you asked me, hey, this summer, let's do a mobility and stability course. And I said, the things I really want to show people are a new way to envision these. There are parts and pieces of the body that can be damaged, altered, impaired, and they can change the way you move. But you can also move like crap for a little while and break your parts. When it is an ankle, I say that's sort of a local problem. When you can't squat, I say that's a global problem. And so looking at exercises, they fit into those categories too. We can isolate. Most people who foam roll have isolated one particular muscle, and most people who are doing something like a sun salutation are globally using mobility throughout their body. There is no right or wrong answer, but taking somebody's word for it that they need mobility or stability exercises is the surest way to show me you're not a professional, and then coming at a problem without measuring it so you can do exactly what you said, recheck.
Right, just because you feel tight or a person comes in and says, hey, I got some tightness in my hamstrings or my back feels tight, doesn't mean that's a mobility problem.
It doesn't. And so what I want to do is let's learn to make them ask us better questions, and let's make ourselves answer those questions in a more professional and systematic way. Because here's the one thing we all get bit by. It's happened to you, it's happened to me. We get on a new tactic, a new trend, a new methodology, right? Remember when I first learned dry needling? I stuck a lot of needles in you. You didn't need a lot of those needles stuck in you.
Especially where you were sticking them.
But I needed to get some practice. And I love it when we're enthusiastic, but we shouldn't let that change our professional outcomes. So when we see bad movement, okay, we call that dysfunction. Now, if it's caused by pain, that's a whole different problem. And so when you have pain and dysfunction, we basically look at it in a system that sorts that, the SFMA. Michelle is one of our key instructors with that and has embraced that with the medical community. But when you've just got bad movement, what that really means is not good enough. A functional scale says if your balance continues to be like this, you are having risk that people who don't have this balance problem don't have to have. And so how many risk factors do you want to take into your weight loss journey or into your NBA career or into your golf game? Well, you don't have to take those risk factors, but I know people that have been working on mobility problems for years, stability problems for years, and I don't like the fact that there's not a resolution. And I want to give you just a bit of science, and then we're going to move forward. When you have pain, inflammation, swelling, and bad tissue in that ankle, your perception is already distorted. So you're working with garbage, the computer term, garbage in, garbage out. Processing is how a pattern goes. So there are people who can't balance that don't have any weakness in the leg of bad balance. And so when we're trying to fix balance with strengthening exercises, they got the strength.
Yeah, so let's hold on, slow down, Greg. So when you're saying, so I sprain my ankle, mess my ankle up, I get swelling.
Yep.
And that's the natural process that the body goes through. It swells up, you get pain, and that's actually normal. That's what should happen because that's a protective mechanism. That is going to decrease my ability to really know what's going on in my ankle, right?
You're supposed to limp.
It's supposed to hurt, right? Now, where we're getting is, this is almost a little bit of a yin-yang. A global pattern could create a local problem, a local create a global problem. So the thing we're talking about now with this sprained ankle, which is very common, is that perception is decreased, which is going to disrupt the global pattern. So now talk about how the global pattern would make something locally messed up.
Well, we've done this. We have seen that kid with a grade 2 ankle sprain because you got him on the field and I got him in the clinic, and we cleared the ankle with x-ray. We tested it locally, but guess what? They still limped. And so their parents said, does this still hurt? It's like, no, but they've been walking in a cast for 2 weeks. And so what happens is the part influences the behavior. The part gets better, but the behavior remains. Now, I'm using limp as an example, but a lot of people get bit by low back pain or have a hernia surgery and they quit deep squatting.
Well, you take this person, this athlete in this example who sprains their ankle, who now wants to return to the sport. The doc says, great, no problem, the ankle's healed up, but yet they got a bad squat, they got a bad lunge.
They got a bad Y balance test.
They got a bad Y balance test, and too often those things are not checked because now the part is good, but we didn't translate that good part into a good processing of that global pattern.
What's getting ready to happen is we're going to wind up the day doing a bunch of functional exercises that both fix the finishing parts of mobility and stability problem, and it blows people's mind that the same moves can hit save on a mobility document. We start in different paths. So you find your core, I'm
going to try to slow this down a little bit too, because we're talking about mobility and stability. So we talk about this local pattern that a person, a local problem this person has. Is that a mobility problem in this example? Where the person sprained their ankle, the ankle seems to be good, but now they can't put it into a global pattern.
Yes, because they were...
Oh, which one is it?
It started here, but as soon as you've proven the range of motion and strength is back, if the pattern doesn't exist, then even though in physical therapy I get paid by your insurance company, I did not reinstall what was lost. What was lost was not just some tissue homeostasis. So we lost pattern homeostasis.
As a good therapist, or athletic trainer, whoever's working with this injured individual, if you, which everyone should in order for them to get released, they have good range of motion, they've got good strength, which means this part is no longer a mobility problem. but have you actually translated into a global pattern? Maybe they got a bad squat, they got a bad lunge. So it started out because he got a bad ankle, maybe as a mobility problem. Mobility locally is good. We haven't translated into motor control.
Now, let me add one thing. When we're hearing people make arguments for why we exercise, when I hear therapists and athletic trainers talking to their patients and athletes about why they need to exercise, chiropractors talking about your home exercise, your trainer, strength coach, whatever, we're always using tissue examples: circulation, fascial alignment, ligamentous, cartilage hydration. We're talking all this tissue. But we never stop. We can't make an equal argument for neurological homeostasis, better timing, coordination, yet we know that the first part of any strength gain has no tissue changes at all. It's all organization of this new
So
app.
is that stability?
Yeah.
And is stability and motor control the same thing?
It depends. If we're feeding stability and motor control bad information, then you can't expect it to be good. And that's why I've always made the statement, and believe me, I've caught a lot of flack about it. You don't have a mobility and stability problem. You got a mobility problem, and it will not allow you to process stability. And that's really what's behind compensation. So a lot of people say, well, you don't have good mobility. All right. We can work on mobility and get that mobility good, but it won't hold because you've got to lean back on that body part and jack it up again. But we also see the same thing. Your body doesn't like to be off balance or out of control.
So it's really a terminology where some confusion comes in. We're talking about mobility. Basically what you're saying is if you've got a poor movement pattern, you're saying it's a mobility problem until you prove it's not.
Until you prove it's not. And I'm going to go further right here. These are some old pictures. In our original clinic together working, we had manual muscle tests done by a computer to get consistency up, and we had 4 different ways to do range of motion, both with the computer and with a goniometer. So it's not like we don't like measuring the parts, but we learned that if all we did was measure the parts and fix the parts, our outcomes were varied because we didn't always get the pattern back. So we also started looking at what I would call relationship. I'm doing a Thomas test on the girl right there in green shorts, and that's looking at the relationship of her quads, her IT band, her pelvis, and her other leg with a locked up spine. But I'm also doing a sit and reach test with both those athletes, showing you that even though they're both touching their toes, they get there completely different. And I don't call these patterns, I call these relationships. So we've got a problem at the part, a faulty relationship, and then we cut our teeth in a very functional gym, restoring that quick toe touch tap that we get out of jump rope, or that lunge that we use for deceleration and direction change. And so we started moving equipment out of our gym, less places to sit, more places to function. And we realized we never had to argue whether it's a part or a pattern, because in our early relationship, we were told to check the parts. But the problem was we assumed that if we got your knee, ankle, and hip mobile, that the squat was automatic. And in very many cases, it really wasn't. So from that relationship, we developed the FMS exercise library, and people go there overwhelmed by the exercises, but you're either going there to strengthen or mobilize a part, or you're going there to fix a pattern. So all of a sudden, a lot of those exercises aren't in play.
But the only way you get there is to do a proper screen or assessment up front, which then takes you down a certain path. So kind of what we're talking about here, if we look at a screen of movement, whether you look at the overhead squat, whether you look at a toe touch, whether you look at your balance, lunging, all the things that should be part of a global pattern approach, once you see one or more of those that are dysfunctional, then that's going to send you down a direction. And that's where we talk about being a logical approach to screening and assessing. Too often people will screen a movement pattern and just throw about a bunch of activities to improve that pattern. Great, we've been talking about this. One of the first manuals that we created had isolation, integration, and function. So we've been doing this for a long time, and there were some people who took that manual and then just looked at the isolation piece and just started doing that. Okay, you got a bad squat. Well, let's take everything that causes you to have a bad squat and let's stretch it. Let's foam roll it. Let's do that, which really it would probably most time work. However, if you don't go through the integration and you don't end up into a global integration and functional pattern that uses all of those parts, you're missing a big piece.
No, I think that's it, because we're not saying don't isolate, but very few times does isolation get you across the finish line, but some people will never make it across the finish line until they isolate first. One of the things that we've done in our survey that we do on lifestyle and our screens we do is we find out there are a lot of people who are living in such a toxic lifestyle. I don't think movement's going to change on their watch, because we talked about this in a podcast. They're not fully recovered. They're sleep deprived. They're running a little bit dehydrated. They don't breathe in half their functional patterns like they should. So it's not a real good fertile soil to plant the new seed of movement. And that's another thing that we weren't talking about in the old days. We assumed everybody was rested and recovered. They either needed a great ankle mob and some tape, or they needed a better lunge functional workout.
But is it easier for us, and kind of what we do is to start globally? We always start global. Look at a pattern and see if the pattern is good, because it's our assumption, and I think it's a pretty good one, that if the pattern's good, all the parts that are required to make that pattern good are most likely working.
What you just said has also been vetted in science, because if we look at musculoskeletal risk factors, ankle mobility shows up as one. But we've got almost 7 points of bad movement pattern, pain with movement, and poor balance, saying if they're not racked and stacked globally, it doesn't really matter. So what we've got over here is if you've got all your balance and all your movement patterns and still have a little bit on the other side of ankle stiffness, from a risk standpoint, that doesn't hold as much water. It's a single risk factor, where we have a plethora of risk factors in bad movement
Well, that goes back to good enough. So we're not saying you have to have every part has to be perfect. You've got to have exactly the right range of motion. But if the part, the example we're talking about is the ankle, can access enough range of motion to squat deep, to lunge, to do all the functional things, it's good enough.
Then why would you need any more?
Right, why would you need to do any more?
So one of the things I quit doing a long time ago, whether I'm working with a medical script from a physician, or what a parent tells me about their kid, or what an athlete tells me about their pain, I assume that it's inaccurate or incomplete, and it's not personal. It's what I gotta do to check all the boxes that people don't check when they're in pain, when they're pursuing an agenda, or they're very myopic in their approach. And so I'm assuming an inaccurate diagnosis on every patient I see, and it doesn't mean I don't respect the professional you saw before.
Well,
I own it.
Well, they have a diagnosis, or they think here's the problem, and what we've been talking about and trying to advocate for all this time is figuring out the underlying problem. What is the underlying issue that we need to prescribe some type of exercise or some type of treatment to attack the underlying problem, so ultimately that carries over into our pattern that we're trying to improve on.
So one last thing, a lot of exercises that are deemed corrective or deemed preventative have been stolen right from rehabilitation that was based on inaccurate and incomplete diagnosis. So there's a lot of people right now prophylactically strengthening the shoulder of throwers in a very non-functional position, because that's what they've seen us do in rehab. They don't just realize we were just trying to get blood flow after surgery. We're going to finish with some arm movements much more robust than just doing something that's safe. You're not going to hurt anybody doing this, but after a certain point, you're not going to help them either. So we've got a way we want to sort of talk about movement in pattern and part, and we're going to use an FMS score sheet in a scenario where we've got both scenarios laid out in a case where the part is been measured to be unfavorable and the pattern's also bad, as opposed to the part being good and the pattern being bad. So the first one right here basically shows you tested with a stiff ankle and you also tested with a poor squat. What are you going to do with that?
So if you've got, and one rule that we've kind of created over the years, the more consistently you are dysfunctional, the more likely it's a mobility problem. The more inconsistent you are, the less likely it's a mobility problem. Here's what I mean by that. Keeping that score sheet right there, the person has a bad squat, But what if their lunge was a 3? So they got a bad squat, which requires ankle mobility, but let's say their lunge was a 3, well, that's less likely it may be an ankle problem. But however, now, one reason we added the ankle screen into the FMS a few years ago is we weren't capturing ankle mobility quite enough. So now you got a bad squat, and now we can tell you and prove whether the ankle is driving that squat pattern. So now we got a bad squat and a bad ankle. That tells us the reason you got a squat pattern problem is the ankle. Well, what about the upper body, Gray? Well, that's how we do all 7 tests. Look at the squat. Next thing I'll always do, look at the shoulder mobility. Is it the shoulder mobility? Is it the leg raise? Or is it the ankle driving it? And that tells us whether it's a mobility problem or more of a motor control problem. And in this example, we got a bad squat, we got a bad ankle, let's go after the ankle. We can't make the assumption.
Now, there's another way we could go after the ankle. We could do a global pattern that involves a lot of ankle mobility, but sort of on a very narrow path. It makes you sort of compare that left and right side. It's within your wheelhouse. A sun salutation explores ankle mobility. So we could get ankle mobility by messing with an entire pattern and get you to reintegrate it, making incremental improvements.
So what Gray just said right there, here's one thing we know, and why taking a global approach is what Gray always says, the 80-20 play. Because we know if you got a bad ankle, even though in this example, it's not making your lunge horrible, it's not making your hurdle step horrible, it's driving that squat pattern problem, but sooner or later, Gray, that bad ankle is going to disrupt everything up the kinetic chain. We could argue it's going to disrupt your shoulder mobility. It's going to give you a bad leg raise. So at some point, why don't we go ahead and put a global pattern approach so that we kind of dust off everything that we know the ankle is driving?
Let me tell you one reason, unless I know something about your ankle.
So let me back up.
Okay.
Is this a mobility problem?
Until I prove it's not.
So we're saying this is a mobility problem, but we may be fixing it by maybe a motor control.
You're right. I'm going to take a global approach. I'm not going to ask you to stretch a thing, and I'm not going to do a thing. I'm going to assume that we're going to use a general car wash before we detail any specific part of your car. So even if I'm sure you do have a legitimate ankle problem, the way you have to move around that ankle has also created a ripple effect in your body. And by asking you to do these 3 moves that I'm going to call a global pattern, you're going to become self-aware in like 3 different body positions how that ankle is affecting you in the way you move. So remember what you said when we kicked us off? So you can recheck? Well, my recheck is the movement screen. Your recheck is the global pattern that I made you do today, because if I come over here and fix your ankle, you'll feel a difference here. But if this actually made a difference, you'll feel it next time you do it.
And I think too often that's the mistake someone may make, is they only focus on local and make a big leap to going into a functional pattern. All right, the squat pattern is bad here. Someone may work on do some ankle range of motion activities, do some very isolated activities, and then go put them in the squat rack or go ask them to squat. And there's a very much a system that you can follow that basically puts you in a position to now not only do something local, but connect all the dots so that you're processing correctly.
Right. And in the clinical environment, if I'm working on your ankle, that's a safe environment for me to work local. But when I send you home, I just want you to reinforce what we gained. I don't want you to make gains at home if you can't, but hold what we got. The alternate problem could also be true. There is no mobility excuse for your bad squat. But what do we often see when we don't see mobility problems? We don't see an impressive push-up and then all of a sudden the squat's not good. Yet this is a dancer, this is a gymnast. They've got great mobility, yet they can't squat completely without their knees caving in or one heel coming up. That could be them fighting through a pattern because they have a lack of integrity somewhere else. So in one case, we could start with the part or the pattern, but I say just let the pattern do its thing. If you measured the part, you got that recheck too. But when we don't have a part, you should feel very comfortable working on the whole pattern, knowing there's nothing behind that. There's no reason to limp anymore.
And that's why it's so important to look at these screens in different postures and positions. Don't just take one movement pattern and think that's all you need. And I think that's been some of the mistake our profession, and we look at strength conditioning and fitness, that they look at the overhead squat and they don't look at other things. The overhead squat's a good snapshot, but if it's bad, we need to figure out and look at the other things to figure out why it's bad. In this example, squat's not where it needs to be, But all the things that make up a good squat are okay, or what we say, good enough. So now we could definitely go and take the global approach. And hold on, getting back to mobility and stability. That's more of a stability problem.
Right. And so we don't have bad tissue, we don't have limited range of motion, but we've got a real poor conductor for this band. And sometimes we just need to refine and polish that because we don't know what happened in your past.
In that example, what's the conductor?
Of an orchestra.
No, it's your brain. Your brain is the one processing all the information. So in that example right here, where you've got what we're calling more of a stability problem, you don't have any perception problems. You've got range of motion, you've got good mobility in all the parts, brain's just not putting it together.
Right. So even though a lot of these global strategies have a lot of stability baked in, they have some mobility baked in, so many times we have our book of mobility exercises, we point at mobility people.
That concept right there, Gray, is what I think we really got to get across, is because that's the process. That is the flow, if you will, of where we need to take someone through different postures and positions during their activity, during the exercise. Because that's what we do. We do some ankle mobility work. We do some other stuff. Maybe we get them into a squat. Maybe we do something else. But we need to go ankle mobility, work ankle mobility, integrate it into different postures and positions. So ultimately, you're not just getting the ankle, you're getting the ankle communicating with everything. The upper body, the knee, the hips. Because if the ankle's off, everything's off. You don't have the perception. If the ankle's good, once you get the ankle moving in maybe some local activity, put it into a pattern. So you're connecting the dots.
Well, we could go right to a motor control situation and have ankle weakness in isolation and a bad lunge. So we could either strengthen the ankle in isolation, or we could do some degree of lunges like an assisted lunge, or make a lunge a little bit easy and let you bring that ankle up in a more functional pattern. Both are arguable. My money goes here, 80-20 play. Unless I know you've got a serious issue in that ankle, I will probably want to see, because this is not a vulnerable situation for me. I've already screened you. So I know you're appropriate for a global pattern because I know what patterns you can and can't do, irregardless of whether you have a weak ankle or not.
So, and when there is pain in some of these situations, if you're in the rehab setting, you definitely know you need to go local. Right. Because you've got to do something to get that person out of that pain so you can progress them up to finally more of a functional overall global pattern.
It is also possible to have a fully strong ankle in isolation and still have a bad lunge. So the ankle appears weak, the ankle looks like it's going to roll, but it could be the hip position, the T-spine position, or balance that's forcing you to be that way. So many times we hear the term, and I know you guys do too, give me some mobility exercises, give me some core exercises, some balance, some stability exercises. No, I'm going to give you some movement reclamation. We're going to reclaim movement. And we might have to get the part ready, and we might have to get the pattern ready. But one of the things I threw out in the mobility and stability course I did this summer is, when I see tightness, I don't know whether you're tense and it's muscle tone caused electrically by processing, or if it's tissue that's inflamed and poorly integrated and swollen and painful and stuff like that.
Could you easily substitute tightness in tone, or tissue in tone, mobility and stability?
Yeah, you can. You can. But if you do have a problem or you don't feel stability, you instantly put on a park and brake and
which is my example. So for example, for me, you ask me halfway through the day, I stand up on my desk a lot, I have a stand-up desk. Halfway through the day, you ask me to touch my toes, I get right there. Now I feel tight in my back, I feel tight in my hamstrings. But you give me a little toe touch progression, I'm down to the floor.
So pull that foam roll out real quick and let's talk about that for a second. Because when we started doing, this was our first attempt at a global pattern, and people have seen us do this and we've talked about it, but instead of just touching your toes, Lee, put your toes up on the front of there. I'm going to dispense with a lot of formality. There's a lot of other things we could do to get you activated, but I want your feet touching for consistency. And if you see he's in a dorsiflex position, but if you're thinking just with your kinesiology brain, you'll miss the fact that I've also made Lee stand up straight and lean backward. And so a lot of times people can't touch their toe because they're sort of fixed. They're holding themselves up with their legs. The other reason is people can't touch their toes because they don't know how to weight shift. So if they go any further down, you'll lose your balance and fall. So whether you're putting on a park and brake or just feel your hamstrings are tight, I don't know if they're tense because you don't trust them or they're inflamed because you sprained them yesterday on a 5K run. Touch your toes. Good. Now come back up and reach for the ceiling. This time, I don't care if you bend your knees or not, but get to your toes every time. Bend those knees. Good. Also, inhale on the way up, exhale on the way down, and try to go past your toes to the floor if possible. Keep going. Work it out. And I'm going to get you to do it twice more. Bend your knees less each time, but never lock them. Now, we do this, and I've seen it have greater results on a single person's toe touch than a bunch of foam rolling or manual stretching or even hamstring massage. And that's because the processing in your toe touch was off and your plasticity says just a little bit of reintegration, it comes right back.
But taking a step back, literally, taking a step back, is that a mobility problem or a motor control problem? If you look at me and I do that, how do you define that?
Really,
No, mobility, stability. Don't overthink it.
If it changed that quick, it's stability.
But if you look at me, typically you are lacking the range of motion to get there.
Right. So it is a mobility problem, but I actually changed it with a neuroplastic move.
Which is a lot of the confusion we've had over the years. We say mobility, we've got to get you mobility first.
Right.
We make that statement a lot, and there's a lot of people that would say, well, don't you need stability in or around your core, and you got to have stability. Yes, both are true. But in order for you to get the right amount of processing, you got to have the right amount of perception. Right. And right now, Gray, if this is all I got, then my brain doesn't have enough of this.
Okay. Now let me give you a scenario.
And I'm going to have to compensate to get that.
Let's say Lee's got some tight calves and tight hamstrings. I could lay you on the table, do one of those roller sticks. I could give you a foam roll. I could do a bunch to get you more range of motion. But there's nothing I would have done to require you to use that. Now here won't get you quite as much range of motion, but it'll easily get you good enough, and you got to own your frickin' posture and balance and breath the whole time.
Right.
So I'd rather gain 5 degrees that you can hold for 3 hours.
In a global situation. I think that's the key, and that's really one of the concepts we're trying to get across. There's nothing wrong, Gray, with putting someone at a table and doing the foam rolling, but you got to connect them here. Part of what we're saying is, okay, let's try this first, and then see if it works. If the global pattern works, then you may not have gained as much range of motion in the local joint, but now you got better perception, better processing, better function.
Everybody talks about how mobility strategies and stability strategies are different, but movement strategies employ both to get there. So let me take you guys through a little thing that I always sift our exercises and evaluations through. If you got a mobility problem, I need you to connect the feeling of tightness and the fact that we measured that you are and experience that data. I want to do that. So I got a movement screen or a movement test or a movement assessment that tells me you're tight. I just gave you a global pattern that made you feel very tense in a few positions. So we both agree that you got a mobility problem. Now, here's one thing that I think people gloss over and skip and go right to our exercise library, including us sometimes. What are some of the things that make you be unnecessarily tense or tight? Well, a postural load. What's a postural load? You said, I'm standing too long. Maybe if you took a quicker standing break, you'd be fine. Secondly, neurological complexity.
So, all right, postural load. Basically, all you're saying there is your decrease. So go from standing to half kneeling. Go from half kneeling to quadruped. Quadruped, and what do we say, Gray? That's what we talk about all the time in all of our courses. Supported spine, suspended spine, stacked standing. All we're saying is decrease those as a good way to start this process.
My criteria for a good global pattern is it uses 3 or 4 of those spinal positions, and it really does make your brain own what you gain. So if we keep looking at these things, we've basically got inappropriate breathing and protective reflexes. So what's really popular right now? The vibration guns, right? Well, that's protective reflexes. That means you're doing something so wrong that your muscle is the park and brake.
And even thinking about some of the breathing, you talk about breathing. I know that's another thing that I think hopefully a lot of people are starting to gravitate to. But as soon as you ask a person to go down and touch their toes and they get limitation, what are they automatically doing?
Yep.
They're messing their breathing up. So I'm a prime example. About halfway through the day, if I don't do my little toe touch progression, I get here and I'm going to go, I'm going to stop breathing. I'm going to tense up. And many times, just by simply doing some breathing things, Gray, you get through your mobility and you improve your stability.
So if you truly had a posterior chain inflammation or tissue problem, a good sniff of air and a half foam roll would not change that in a matter of seconds.
Right.
So you're bringing a lot of tone, and there's a good chance you're not protecting yourself from that. But once we know you're protected, we constrict your path to those few movement patterns that you need to refresh each day, right? Refresh the screen, right? Turn off some apps, see if you reset. If you reset quickly, you were overloaded, not broken. And lastly, I think we get stuck in correctives and never transition back into function. Now, here's what I want to show you. When I see a motor control and mobility problem, they look the same way as far as motor learning you back into good enough movement. So when you look at the similarity of global patterns, there will be a little more mobility in a mobility global flow and a little more stability challenge in the stability flow. And once I get you on your feet, I can challenge your symmetry as well. And so I will challenge or squeeze that constricted path, but I'm going to feed you both mobility and stability at the same time because that's the way you remember it, because it's about movement, not a freaking exercise station.
So why wouldn't you just tell somebody to do just a good flow or a global pattern?
I do. That is my new.
So why screen somebody?
Because you want to recheck it. Because if I said 80-20, that means 20% of the time we could probably have done a better job. And I want to know if I can do that better job. So I'm going to set a baseline, even though I already got a pre-canned philosophy that's going to fit you a different way. You're going to come out of that. So your experience here is very meaningful to me. And I'm not just going to say keep doing it if we have a bad experience.
And we've got to figure out and see if there's any pain. Because once you have pain with some of these activities, that changes everything. And it really forces you to go down to the parts and figure out what the underlying issue is and improve upon that.
No, so once again, you should be able to make an equal argument for, do I see a lot of tone or do I have a tissue problem? If I give you a toe touch progression, it doesn't hurt you, but it also doesn't change in an impressive way, I'm thinking you got some tissue challenges there. I'm thinking we've pushed you about as far as we can today.
Which means if I've got some tissue, so the toe touch doesn't work. Let's say it doesn't work. That means most likely what you're saying, that's a tissue problem, which means now you would be more appropriate doing some more foam rolling, doing some more localized activities, right?
But I could also challenge your recovery and say, hey, if you can touch your toes after some compression boots on your legs, maybe swelling was... So you see the way we do this, but there's no good reason when pain's not involved not to lead with global, because that's the way it's used. And when this doesn't work, your drop backs are so much clearer instead of starting here and hoping the other way. So be able, in your education, in your study, in your screens, and in your assessments, to make an equal argument as we have right now for whether we should start at parts or patterns. And to me, the reasonable argument in most situations is start with a pattern, because if all it does is provoke pain or set a baseline, you now know.
So if you start with a pattern and the pattern gets better, you had a motor control problem or stability problem.
The majority of your problem was tone. You were using your body inefficiently.
If it doesn't, then you've got to drop back and make it a mobility problem. And I think that's where some of the confusion comes in. I got a bad toe touch. Well, we're saying you lack range of motion, you don't have good motion or mobility in that pattern. But we may fix it by doing a global or a motor control activity.
Let's take...
Which all we're then looking at is, did it fix it?
Okay. So let's take the toe touching Lee problem.
Yep.
And say, all right, you know how to get your toe touch back, but you still lose it every day after your standing desk. We know some things that'll help that. Next time you're on a phone call, take a knee, stand back up, or just get in your chair. Don't stand quite so long. Yeah. You overloaded that.
Yep.
But we can do the toe touch progression, but that's going to get old for you after a while. We can do a mobility flow, but that's going to get old for you a while. Grab a kettlebell and let's do a single leg deadlift. Because one of the reasons that we may be having that mobility problem in the first place is, why would we assume that you're standing 50-50? So if you just put your foot beside that little bitty kettlebell, and we got you a really little one so you won't have to work hard on it.
Exactly, I don't want to work today.
try to get to that kettlebell without rounding your back. But I don't care how much you bend your knee. Good. Now, yep, try to come up from there. Now, anybody knows anything about a deadlift at all, Lee didn't do a deadlift. He did a lot of squat, but I'm calling this a single leg deadlift. Now, our drop back position for Lee is to make his back look exactly like an instructional video. And let's do the single leg deadlift like this. Because this
Can I put it down like this?
Yep, no. Looks a lot better. It was a lot more challenging for him. Here's one of the big mistakes. Nobody ever takes a stool away, or nobody ever makes it smaller. But believe it or not, if I can really make you struggle, I'd like to see 3 of those and let you work through that organization, then 15 of these, and use that backward balance. But own your back, own your hips, even if you've got to bend that knee. And if you've got to use a little bit of squat in your deadlift, that's still the best way to lift a box right now because you don't have that mobility. But you can see how this is squeezing your ankle mobility, your core. It's really working that. Now, if this was just frustrating and difficult for you, of course you get the stool.
It's definitely going to be frustrating and difficult. Because you put me up against my weakness.
I put you right up against your weakness because that's not a lot of weight. It would have almost been as hard without the kettlebell.
But we don't start there.
Nope.
You got to get my toe touch. And if my toe touch didn't improve, what will be your play then?
I might actually take you off your feet and into a position like quadruped or half kneeling or some of those things you see in the flow. So one of the articles that you and I collaborated on a long time ago, it's called Functional Training for the Torso. And the reason we called it that is nobody was using the term core at the time, and we got published in the NSCA journal, and we were doing chops and lifts. And one of the things people want to know is, was that a mobility or stability exercise? It was a functional exercise because stability people have a hard time narrowing their base, and mobility people have a hard time completing the range of motion. You mind doing a couple of those
Yeah,
for us?
let's do it.
Let's do the chop first because a half kneeling chop really is one of my favorite transitional patterns. You can see that half kneeling pattern in a sun salutation and a Turkish get-up, and we can orient Lee a number of different ways, and we're just going to face him in this way, but the first thing I do is have him do it both ways. We look for left-right differences, and we look for that natural angle. Secondly, anybody can do this, and you can even do it at a more elevated surface if you need to, but for Lee's to have a very narrow base, his foot would have to come in that much. A person working on stability will be really challenged usually on one side with a base that narrow. Just try one right there. It's going to go a little bit slower, and I want it to, but maintain your balance. Whereas widen back out, he has all kinds of room for mistake right there.
Well, and what you said, Grace, so here, challenge a stability person. Here, open them up, but a mobility restriction is going to look like what? They're going to go something like that.
Exactly.
They're not going to want to keep that hip keep that hip under them, with that knee under them, keep good hip positioning. They're going to feed into that flexion. So mobility is not my problem. So I'm going to want a narrow base.
So if you had a core problem, we'd be coming from a stability global flow, just using body weight, to some strengthening exercises like this that keep 18 holes of golf from taking your toe touch away, just like standing 3 hours on a conference call is going to do the same thing.
Now, let's check out the other side, though.
All right. A whole different day over here.
Yep. A lot weaker in this position.
So, the exact same difficulty, you noticed, we could have shown that on a single leg deadlift from the bottom up. Now, the funny thing is, these are 2 of my favorite exercises for shoulder. Single leg deadlift is a static shoulder, dynamic hip. This is a static hip, dynamic shoulder. So the chop and lift are actually my go-to moves, whether I'm finishing a polish of a mobility path or a stability path.
And that's the key, is you go, whether it's a mobility problem that we've identified because your global pattern did not work, so you got to step back, you still have to go through the whole process in both in a functional way.
I'm not going to let you out of this till we look at your lift too, because the next biggest mistake in functional exercise is we chop because it looks like it's good for your core, but we don't lift. And that's what makes your core fit good posture. So the reason I got Lee on an elevated surface here is because I want the angle of pull to be the same. So his chops and lifts should both fit this imaginary X. Now, slowly narrow your base and see how it's going. You're always going to be weaker in a lift than in a chop because you're going against gravity. So you can use a more robust weight pulling down, lighter weight up top, but I'm looking for symmetry in the left and right chop, and I'm looking for symmetry in the left and right lift. So while Lee's facing the other way, the one thing I want you to know, and I've been saying this since a book in 2003 called Athletic Body and Balance, that I am literally looking at Lee doing his chops and lifts, and I'm looking for the pattern that's most difficult with a narrow base. And so once I find that pattern, it doesn't mean I don't do these, but I really try to get that little level of inconsistency, vulnerability, coordination, loss of balance, really, effort, smooth back out. So what do you get here from a mobility or stability problem? Single leg deadlifts really prove the point of functional balance from the bottom up. And this proves it from the top down.
Why are you sitting down? I just
did
did the exercises and he sits.
I got a little tired watching you do that.
So honestly, it can be confusing. There's a lot that we just went through in a short amount of time, which is one reason we did those courses on mobility and stability, is to kind of break them down and make it a little bit more digestible. But I think the bottom line is we basically define mobility as a limitation in a pattern. How we fix it could be mobility or stability. But like Grace said, just start with some motor control and globally, and then go back and recheck. And if it works, you're on the right path. And if you're not seeing some improvement, go back down a lower level postural position, maybe do some specific mobility work, maybe locally, but always finish where you're connecting all the dots in a functional way.
One piece of semantics I want to leave you with. If in the movement screen, a mobility problem flushed you out, it is a mobility problem, even though we may use resources from both mobility and stability exercise to get you over that hump. But if we see poor balance or poor coordination or poor stability, we call it what the test identified. So your deep squat gets better when your mobility gets better, but your deep squat also gets better when your core stability gets better. So we have to call it what the test station identified you as, but the way it changes does not limit. Now, he and I had access to 400 or 500 exercises a day from the library. We showed you a single leg deadlift, a chop and lift, and 3 different global patterns that get you to those exercises. So don't let this be confusing. You've got to look at some flows to see which one's going to fit the next situation you're at, and you really got to own the chops and lifts and single leg deadlifts, because that is a functional base that we've been talking about for a long time. And when I got a chance to be in Tim Ferriss's book, The 4-Hour Body, those are the exercises that I threw out at him, because they are the finishing touch of most of our movement screen problems, and not going through that is why a lot of those problems never get finished.
So Gray, we're going to take some questions. We got about 10 minutes, so we'll take just a couple of questions. Michelle's, I'm sure, has been sifting through some of them, so she'll throw a few at us. We're only going to take a couple just to kind of finish up on the right amount of time, but keep them coming. Put them down in the chat. We'll get to them. I'll be checking it periodically. But, Gray and I are actually committed. I've got him committed to trying to consistently do these YouTube lives, try to kind of come up with some of the stuff we've been working on, throw those out as we continue to do these. So continue to be on the lookout for those. The only other thing before I open up the questions is Gray and I are actually going to be teaching. If you're in the Chicago area or Midwest, we're going to be out there teaching our level 1, level 2 FMS seminars next weekend. So if you're around that area and want to check it out, we'd love to have you. We really get into the weeds a lot more in those couple of days. So Michelle, see if we got any good questions, throw them at us, and so let's see if we can get them done in the last 10 minutes.
Thanks, Lee. All right, so a question did come in, a couple questions actually that I'm going to send your way is, one of those questions is, FMS principles, why do we start with the mobility over the stability? What is the reasoning for that? I know you talked about that a little bit here, but if you could just re-emphasize why we prioritize mobility over stability.
Mobility problems will actually force you to unnecessarily compensate simply not to fall over or to complete the pattern. So it's that garbage in, garbage out thing. A mobility problem distorts perception, and the next processing you have to do is compensation. It's not moving through it. So a mobility problem actually poisons the well for any decision you're getting ready to make. So if you could mitigate that in any way, why wouldn't you do that first?
And I'll approach it this way. If you got a leg raise problem and you got a rotary stability problem, you have problems in doing a bird dog, but yet you got a leg raise problem. If you're limited to that leg raise, as Grace said, you're not going to get the perception because you're limited. Your body's going to work around that issue. But we're not saying you're going to fix that leg raise by simply doing a mobility technique. It may be a motor control activity that we're going to actually improve that leg raise with. We're always going to start with where we see a limitation in what your ability is to do, and we call that mobility.
Thanks, guys. Anna actually just asked a great question that I think would be super valuable for us to discuss right now. She's completed the FMS and SFMA level 1 and 2. Her question is, where do the masterclass mobility and stability courses really fit into her practice? Is there added benefit to her going through those?
I'll take that right away. Obviously, if she's just completed FMS and SFMA, she got a lot of information. And most of that information, because of our intention, is to make sure her eyes are sharp in screening and assessment. But the solutions are very, very robust. We can come at these problems we identify consistently many different ways depending on your patient population, your time, and your resources. So what I did in these mobility and stability courses is you don't have to be certified to watch them, but if you are certified, you see us making an attempt to sort of take a food combination using a chef analogy where these three foods work so well together, I would not separate them apart. And that's what I started tapping into with corrective strategy. It's really nice to have these great exercises, but I saw people start chops and lifts and single leg deadlifts maybe too early, or do floor-based correctives too much and never advance. These little flows, these global combinations of movement, really are helpful with sticking points and allow you to step back and not coach movement, but coach breath and awareness. And sometimes we overlook those things when we're doing it. So a mobility flow is a really good way to sort of get somebody's home program to sort of do the reinforcement part. You did a reset if you got SFMA, I want some reinforcement. So as I was uncovering some of these great combinations, we can't just jam those into a course because you're already swimming in the deep end with new information. We made them available to you because, believe it or not, the last 5 years of my career, these global patterns are some of my go-tos for problems that I used to sort of try to add an exercise, take one away, add one, take one away. And the feedback loop is very robust when we do that. So that's what I would challenge. If you understand screens and assessments, you will see that we're giving you sort of a fast lane to get to where you want to be a little bit quicker. You're not going to make a mistake because you know how to rescreen the progress and know how to identify when they're not making progress.
Thanks, Lee and Gray. All right, so question that came in, and I think this is a great, just considering what we've been talking about today, is the question actually comes back to the FMS, the foundation, of our screening, is where and how did we decide on the patterns that were included in that, what we were looking at? So great question by one of our attendees here today.
Believe it or not, it didn't come from my background as a strength coach or sports, even though we had to name words like squat and lunge and people associate those with the exercise industry. When I was in PT school, I was amazed that a neurological approach to exercise looked very global, pattern-based, and PNF and developmental patterns. When I got in orthopedics, we focused in on the knee and we shredded the knee, but sometimes neglected to cultivate the lunge or squat back where it needed to be. In neurology, we never assume orthopedics are good, but in orthopedics, we often assume that neurology is good enough. And what we've learned by these movement patterns is if I've got somebody in NFL and they can at least get a 2 on the leg raise, a 2 on the push-up, a 2 on shoulder mobility, they've got risk factors. And then all of a sudden we started realizing, let's quit looking at athletes and start looking at everybody and see the same thing in general population. Poor balance, poor mobility in fundamental patterns, and pain in fundamental patterns start that. So believe it or not, we picked these stations that actually made you go into knee flexion. How many different ways? Hurdle step, lunge, squat. 3 different ways, but sometimes the knee behaves differently in each of those patterns, proving that maybe it's the way you're using your knee, not just your knee, because 68 degrees of flexion is the same in all of those. It shouldn't hurt in one and not in the other, or it should be good in one and good in the other. So believe it or not, the functional movement screen foundation came from saying, if you're upright, walking, running, gunning, playing, doing whatever you want, then getting up from the floor should not present a functional problem. And if you look at the movement screen, we give you snapshots of a human being getting up and down off the floor. And if that's a problem, that is in the way of your rehab and your fitness, and it should be sort of that risk factor thing. So believe it or not, it came from neurodevelopmental progressions, which is how you teach yourself to walk. Nobody taught you how to walk. You patterned your way to it in different varying degrees of locomotion. If we go back and touch each one of those stations, we can usually find a better way to feed movement back into you than just training the part in isolation.
All right. Well, Lee, great. Thank you so much for sharing all your expertise and insights and shedding some light on what can sometimes be a confusing topic, the mobility, stability, and why we prioritize and how we navigate through those issues that we might find with the people that we're working with. You know, we've had a lot of questions come in about the FMS itself, and I do just want to stress, right, the information we're gathering from the FMS is for you, the professional, to really make a good decision for the people that you're working with, and going into those interventions. And everything that we just talked about, the mobility, the stability, are those good decisions that you're going to be able to make based off how that individual is presenting to you, how they moved. We're not guessing, we're just giving them an opportunity to show us what they're capable of so that we make those good decisions for that specific person in front of us. Now, you, Lee and Gray, you guys have thrown a lot of fantastic information at us today. We have a lot of people watching. Any final thoughts that you'd like this group to take away with them as they head out and put this into action today?
I've got one, and I'm going to kick it back to Lee. Don't feel obligated to explain the movement screen to your clients unless they're very interested. When they say, why am I doing this? Say, this helps me see what's behind the way you move. This helps me focus on the left and right side of your body. So from this little thing we're doing, I'm going to get a baseline I can't get any other way. So we wouldn't want weight loss if we didn't set a baseline for BMI first. And I'm not really wanting people to say they're doing functional movement without setting that baseline first. So that seems to be the thing that works most often in my explanation about what I'm doing, whether I'm at an NFL camp or whether I'm with Boy Scouts. Doesn't really matter.
Yeah, kind of reiterating that. Bottom line is we're not trying to create confusion. We're trying to remove the confusion. At the end of the day, if you're doing some type of screen or assessment or test up front, that should actually help direct you what you're going to do next. So take that, get that baseline piece of information down, whether you do a balance test or not, and just give them some type of opportunity to improve whatever exercise you want. But the one thing I think we miss out on is the opportunity to get feedback to see if what I did works. Set the baseline, do something, go back and recheck to see if it improves. That's always just a simple cycle or system that you can keep using, and over time you'll figure out which exercises are maybe a little bit better for certain situations.
Well, thanks again, Gray and Lee, for sharing your expertise with us today. And a huge thank you to all those who joined us for this live session today and those great questions that came into the chat. We truly appreciate the interaction and you taking time out of your day to be here with us. Now, I do want to emphasize, if you want to spend some time with Lee and Gray in person and go through some of this thought process, hey, they're going to be in Chicago in next weekend. So it's not too late to go ahead and register for that event in Chicago. I know that we posted the link to that in the chat, but you can also find it at functionalmovement.com. Additionally, if you are interested in learning more about the mobility stability masterclasses that Gray put together, we also did post a link for those courses with a special limited time discount. That's both in the chat, but also in the description for this event. As always, if you have any questions, our team at Functional Movement Systems is there to support you and to answer those questions. So please don't hesitate to reach out to us at support@functionalmovement.com. On behalf of the entire team at Functional Movement Systems, thank you again for being here with us today. We look forward to you joining us again soon. And until next time, everybody, move well and move often.